On the stage, in the middle, we have Dr. Zhang Shuquan, Head of Communicable Disease Branch, Center for Health Protection. To her left, Mr. Tony Wong, Deputy Government Chief of Information Officer, and also on the other side, Dr. Sarah Ho, Chief Manager, Patient Safety and Risk Management of Hospital Authority. Dr. Zhang will first give you an update. Good afternoon. As of last night, we recorded 24 confirmed cases, with case numbers ranging from 10928 to 10951. 6 are imported cases. One of the cases arrived in Hong Kong from Pakistan on the 23rd. The first specimen was indeterminate, so more time was taken to confirm his case. The other one arrived in Hong Kong from the United States on the 24th. Another one from India, again on the 24th, via EK384 in Dubai. The other one from Pakistan, EK384 flight again via Dubai, arriving in Hong Kong on the 24th. The DNA sequence sample shows he's N501Y, a variant that needs further analysis. Another one returning from the Philippines via FJ272. The first specimen had leakage and more time was needed to confirm her case. The other one arrived in Hong Kong from Ukraine on the 18th. She became a confirmed case in the quarantine center. She also has the N51Y variant. So altogether we have 43 such cases, including 27 of the UK strain, 4 of the South African strain, and also 3 of the Brazilian strain, and 9 others are unclassified at the moment. We also have 18 local cases, one of which is untraceable. He's a 59-year-old male who is engaged in the engineering sector in Hua Yun building in Tai Kok Tsui. 3 or 4 of them would work together and they would be sent to quarantine centers together. He lives in Lockman House, Lockman Estate, and he also took part in some activities, albeit not large-scale activities. 17 cases had linkage with other cases, including 5 staff members of Ming's Chinese Dining and also 1 close contact, 5 patrons and 1 close contact. That means this case didn't go to the restaurant, but he's a family member. Altogether, we have 11 patrons in the cluster, including 1 customer who went there on the 18th, and the others going to the restaurant for lunch on the 19th. There are also 5 staff members and 3 contacts, close contacts. Due to our tracing effort, we later identified another close contact. In fact, one of the staff members had contact with this person before the onset, and during the contact, it was the person's during the person's infectious period. So this case got tested. About preliminary positive cases, there are over 20, including 7 patrons, 2 close contacts, and 2 staff members. So altogether, 30 cases, including preliminary positive patrons, close contacts, and staffers. According to our information, during lunch on the 19th, about 76 customers had lunch there. That's due to a tracing effort relying on the bills. and we issued a press release yesterday. For those who attended the restaurant for lunch on the 19th, please call our hotlines. We received 9 calls, and we also approached the restaurant for the handwritten slips. That means those who didn't use the Leave Home Safe app, we were given a dozen slips. And we found that a lot of them have indeed been sent to quarantine center along with the close contacts. Together with the 9 calls made to the hotline, we identified further 8 of them. We believe that the time period at lunch on the 19th of February would constitute a risky period, and hence these cases have been sent to quarantine center. For preliminary positive cases, once again, we appeal to other customers not yet identified by us. If you've been to this restaurant for a meal on the 19th, please call 1823 so that we can cross-check. And perhaps you belong to a high-risk group and should be quarantined. As for the source of infection, so far we've identified 1 staff member on the 14th, 15th, before the staffers went back to work, they got all got tested. The results were negative, and one of the staff members had some coughs on the 18th, and on the 19th of February, the staff worked until some 4 o'clock in the afternoon, and this staff member was responsible for bussing tables and cleaning, and because of the mild condition, because of the rather serious condition, has been hospitalized, and we've also inquired with the employer about the work environment. Together with the preliminary positive cases on the 19th, 8 tables have been found to be involved. Altogether, this restaurant has 20 tables, some 70 of them. Some of them have been sent to a quarantine center. And we're still doing the count and see whether we can locate more. Among the preliminary positive cases, there are quite some of them being untraceable. Apart from those with known sources of infection, we have untraceable cases. One is an 86-year-old female. On the 1st of February, she started to have some coughs. She also had some swelling, and she saw a doctor, and she is wheelchair bound. She suffers from hypertension, and she had a stroke before. So on the 25th of February, she called an ambulance and was sent to hospital. She's in a serious or critical condition. She lives in Liking House in To Kwa Wan, and she usually stays at home. The other case is a 45-year-old male who works in a school. That school's in Tuen Mun. He last went to work on the 8th of February. On the 22nd, he began to feel unwell. This might not be linked to the school, and he lives in a building at 341 Prince Edward Road, and he lives with his family. At the moment, no high-risk factor has been identified. The other one is a 48-year-old male who works at Lincoln House in Taikoo Place. He lives in Block 45 of Heng Fa Chun, and he usually goes out for some activities such as having meals, playing golf. At the moment, this case is untraceable. The other one is a 16-year-old male. He's a student, but he hasn't been to school. He lives in Gam Fun building in Yau Ma Tei. During the incubation or infectious period, he spent some time to have fun in a sports center with about a dozen others He's unable to give us names, and we are doing contact tracing. They may be high risk.
The fifth person is a 42-year-old woman. Sometimes she worked in a company as a clerical staff member in Causeway Bay, and she lives in a small house in Lam Hua Po. And she has attended some gatherings of 6 to 7 people. So it's still an untraceable case. The sixth one is a 20-year-old woman. And she is a clerical staff member of a kindergarten in Hong Kong. And she mainly takes the pupils to the classrooms from the reception. And she hasn't got any symptoms, and she was tested as required by the kindergarten. And she lives in Luk Yat House of Yat Tong Estate. For this kindergarten, we would advise them to suspend classes, and all the people there have to be tested, and there should be thorough cleansing. 38-year-old male is the sixth case, or the seventh case. He works in an eatery in Cheung Fat building, and he hasn't got any symptoms, and he was tested negative on the 15th, and on the 25th of February he tested positive. He lives in Yinon Street 20 to 24 in To Kwa Wan. Well, he doesn't do much, and he had meals with family members and friends. So that's it for the preliminary positive cases. Thank you. And Mr. Wong, please. The friends of the media, I would like to take this opportunity to talk about the Leave Home Safe app and the latest development. Now, Leave Home Safe app is an exposure notification app, and it aims to help Hong Kong people to put down their records on itineraries. And for those who have visited the same places as those visited by the patients, they will be alerted. So we will strive to uphold people's personal privacy. And the OGCIO has worked together with CHB to make the best use of Leave Home Safe to fight the epidemic. To meet the latest operation needs of CHB in the app, we are going to add in different alert functions. Say, for example, if for certain venues and locations and times whereby the visitors have to undergo compulsory testing, then such messages will be given to the users. So that can help fight the epidemic. The latest download number is over 2.96 million times. As the app is gaining more popularity, that can help the epidemiological investigation work. If users use Leave Home Safe, and they can keep their records in an electronic format, and that can help reduce the manpower required to do contact tracing. Comparisons and matching can also be made. So people who have gone to the same places as the patients will be alerted, and an alert will be given to them so that they can take the tests as soon as possible. So the itineraries are in electronic format. There is no need for input of information. So CHB colleagues can follow up on the cases more expeditiously and cut down the transmission chain earlier. Now, to take the cases for Mr. Ming's Chinese dining as an example, among the patients, 14 of them are the app users. And the CHB, in accordance with the records on the apps, have used the open data format and sent messages to other app users who are concerned. And these patients have visited 48 venues before they are confirmed, and such information can also be downloaded by other app users, and comparisons and matching can be made. So for people who have visited the same places, they will be alerted. Notification will be sent to them. I have a friend who has visited this venue in K11 Museum. So he's got this notification from the app. So if you press this button, you can receive the notification. And it will remind you that you should be watching over your own health conditions, and if needed, you should seek medical attention or take the test. And I noticed that some confirmed patients have been alerted by the app, and they take the test, and then they've been confirmed. So, whether the confirmed patients are using Leave Home Safe app, they may provide information on the venues they have visited during the infection period, and such information will be disseminated to other app users via an open data format. Up to now, we have information of over 2,400 such venues, and the information of such venues has been given to app users, and these include restaurants, shopping plazas, etc. So I like to appeal to members of the public. Please download the app as soon as possible. Make the best use of the app. You can help yourself and also protect others. Let's work concertedly to help fight the virus in Hong Kong. We try to uphold people's privacy in designing the app, and then you don't have to register to use the app. All you need to do is to download it, and information of your itinerary will be saved in your device in an encrypted format. It will not be uploaded to other systems or places, and the notification and alerts will only be disseminated via your own device. So there should not be any privacy concerns. Please get the facts clear, and let's fight for the virus together. Now let's ask Dr. Ho to talk about the HA situation. Up to 9 a.m. today, in the past 24 hours, the HA has reported 40 confirmed cases. 19 patients have recovered and been discharged. So far, a total of 10,493 patients have been discharged. Up to 9 a.m. today, 205 confirmed patients are hospitalized, and 18 of them are in critical condition. 10 are in serious condition, and 177 in stable condition. The Hong Kong Infection Control Center of the North Lantau Hospital started taking in patients this morning. 5 patients have been admitted this morning, and the process has been very smooth. Depending on the development of the epidemic, the Hong Kong Infection Control Center will progressively take over patients in the community treatment facility so that we can more effectively use our resources. Up to 9 a.m. today, the number of negative pressure beds is 1,224. The utilization rate 54%. Number of negative pressure ward is 677. Utilization rate is 67%. And
I'd like to brief you on the test reports. I understand that recently members of the public had waited for quite a long time before the test report of the specimen pack that they submitted to the GOPC were received. I'd like to give you some background of this testing scheme. This is mainly for use by members of the public who feel that they are of high risk without symptoms. In the beginning of January, we receive around several thousand specimen packs every day, not more than 10,000 per day. And because of the relaxation of social distancing measures before Chinese New Year, citizens from different sectors of the economy then made use of this method to get tested. At this peak, the GeoPCs distributed over 30,000 specimen packs. At the same time, these packs are available for distribution at MTR stations and the post office. At the GeoPCs, at this peak, we received 45,000 packs in a single day. These specimens are to be analyzed by our 2 laboratories. Because of the surge of demand, including the specimen packs collected at GeoPCs, together with community testing centers services, one of the testing agencies are unable to follow the contractual requirement and provide the test results within 48 hours after testing. We have urged the relevant laboratory to clear the backlog as soon as possible. At the same time, we have approached a number of private laboratories. Starting from next week, they will gradually be commissioned to increase the daily testing capacity. I would also like to appeal to members of the public once again that if there are symptoms, they should seek medical attention as soon as possible. The specimen packs only seek to help members of the public without symptoms to get tested. If there is a need to get the test result as soon as possible, citizens may also go to the designated testing centers that provide services, especially for certain sectors, or to the relevant testing centers. I'd also like to report on the inventory level of PPEs. As of today, we have 93 million face masks, 7.5 million respirators, 9.5 face shields, and also 15.7 million gowns, protective gowns, and the inventory level should last us for 6 months. Let me also supplement about the names of buildings I haven't finished. For untraceable cases identified today, they live in the following buildings: Lockman House, Wong Tai Sin. There are also other cases with no source of infection living in 11 buildings, including Wyman House, Oiman Estate, Chung House Street, Ho Min Tin, Park Palace, Block 2 in West Wiley Road, and Choi Kyu House, Choi Hing Court, number 1 Choi Sing Lane, Kwun Tong. Camlux Hotel in Kwun Tong. That's because this person felt that he might be of high risk, so he moved to a hotel from home. And also Block 22, Shekimei Estate, Shamshui Po, Mayway House, Shekimei Estate, and Baycrest, Block 4 in Sha Tin, Heiwa Building, Block B in Lockhart Road, Wan Chai, and 122 to 124 Broadway Street, Phase 8, Meifu Chun, Sao Hong House, Samaping Estate, Kwun Tong, and Yutai Court Block B in Tong Chung. The floor is now open. Please introduce the organization that you're representing before you put the questions. I'm from Now TV. Good afternoon. First, about Ming's Chinese dining. Can you tell us more about the source of infection? Are you suspecting that the person doing the cleaning and bussing of tables is the source? Can you also clarify, you said the staffers got tested before they resumed work. When was the test done? Was the test result negative? Has any environmental sample been collected? Because of a lot of staff members, even patrons, getting infected. Basically, even if patrons are having meals with their mask off, staff members should have been keeping their mask on. Why is there such a transmission from patrons or to and from patrons to staff members? And are we seeing a surge of cases? Is there a rebound? Is it a reflection of the cases that accumulated over the Chinese New Year? Are we picking up an upward trend? For Ming's Chinese dining, we suspect one of the staff members, because of the onset date and the days when she went to work, she's responsible for bussing tables and carrying the utensils to the kitchen area. Of course, wearing a mask could help reduce transmission, but I'd say, after all, it's a closed area, so the mask may not be 100% effective. Given that somebody did cough there could be droplets suspending mid-air in the corridors and common areas. So patrons might, as a result, get infected. That's our suspicion. Of course, the restaurant have had several rounds of deep cleansing and disinfection. We don't believe that virus could be identified in the environment. Now, there are 7 tables on the first floor and over a dozen tables on the ground floor. But many patrons sat on the ground floor quite close to each other, and there might be a super spreader among them. So for this case, after she went off duty on the 14th, she went to get tested. The test result was then negative. The number of cases has increased drastically. The Ming's Chinese dining might be one factor. At the same time, according to our analysis of the confirmed cases before and during Chinese New Year, we see a lot more meal gatherings and outings. Previously, there might be small-scale family gatherings, sharing meals together at homes, but now we see more and more activities, visiting sports centers, outings, etc., and this might increase the risk of transmission. There might be silent transmission. Next question, this lady here. Dr. Zhuang, I'm from Mingpao. Good afternoon. First, on Ming's Chinese dining, among the confirmed cases today, can you identify the case numbers concerned? And what about the total number of people quarantined in the cluster? Is that over 30? And what about the CT values? About the IT staff, this is a question for the hospital authority. What are the test results of the 3 contacts concerned, the colleagues? On the 19th, you've decided that those who went for lunch on the 19th would have to be quarantined. Why not for those on the 18th as well? And about the distribution of tables, can you tell us how many tables and how far apart are they on the ground in the first floor? About Leave Home Safe app, the media actually received complaints. On the 18th of February, somebody showed us a Leave Home Safe app visit record between noon and 2. He was actually in that restaurant, but he never received any exposure notification from the app. Has the government received a similar complaint? He didn't receive any notification despite having gone to the restaurant during lunch. Is it because the person went on the 18th instead of 19th? And also about vaccines, can you tell us the number of jabs administered? And according to your observation, has anyone experienced side effects to the extent that he's hospitalized? And some elderly citizens have opined that they don't know how to make an online booking. They tried to line up outside Central Library to no avail. Would there be follow-up action?
According to the the number 10929, 10932, 10937, 938, 939, 940, 941, 942, 945, 948, 950, and 951. For the suspected source of infection, that person, well, she didn't go to work on the 18th, but she did go to work on the 19th. But we have to check again. We are just asking the others. We have to check the information with the person herself, and that explains why so many on the 19th were infected. And well, was the person infected on the 18th related to the other cases? We're not sure. Now, as for Leave Home Safe app, for every confirmed case, well, a broadcast will be sent out. Now, as to why that person has not received the exposure notification, maybe there are some technical issues we have to check. For the basement, there are 7 tables upstairs and a dozen or so tables on the ground floor. We're just checking who sat where. And for the 7 tables with people confirmed, to our understanding, well, all of them were on the basement floor. The tables were separated, of course. But then if there was a super spreader passing by, and there might be virus in the droplets and in the air, then if people are not immune, then they will be infected. Well, there should be a total of 76 patrons. Well, we have to check how many have yet to be identified and located. We have to check who sat with whom and so on. So we are doing all these work. Now, as for vaccination, I'm not clear about that. I believe that my colleagues will follow up duly. Let me supplement. This media friend referred to the app. We haven't received any complaints of the kind she mentioned. Now, if the CHP has broadcast the incident on the 18th of February, theoretically, all the users would receive the notification on the date and the venue. Well, even if there is duplication, then the users will still receive the notification. Like I said, my friend did receive the notification. Whether the person receives the notification depends on whether there is a network available to the phone of that particular person. But if the person is worried, the CHP has made an appeal. The person can take the initiative to take the test. And if he finds that there is a problem with the app and the system, he can make inquiries with us. And we'll check whether it is the problem with his phone or what. The CT value of the person mentioned is 18. Regarding the HA colleague's case, so far no further confirmed case has been identified. So we will monitor the situation closely. Sorry, the speaker's not coming through. Some other colleagues are responsible for that. I don't have the information. Sorry, the speaker's not coming through. So far, we haven't received any. Next one, an English question, please.
Hi, RTHK. So you said that you found 30 cases so far linked to the restaurant. Can you tell us how many people actually had meals on the 90th at the restaurant? And why did you target customer who had lunch there on the 90th specifically? And you said that a waiter or waitress may be the source of the transmission. can you tell us why you think he or she might be the source? And was there any possible super spreading event, or do you think that he or she might be a super spreader? And would you advise people to avoid going to restaurant in light of this event? How would you assess the risk of people dining in at restaurants? And also about the contact tracing app Leave Home Safe. Have you successfully contact traced any infected person through the app so far? For example, were there any close contacts being identified? I mean, close contacts of people who visited the restaurant being identified through the app? And also, you said that the app has been downloaded 2.9 million times. How many of these downloads were from Hong Kong actually, and how many were downloaded from overseas? Thank you.
So far, all the customers except one had lunch on 19th of February, and the clustering is quite obvious. We can't exclude that the customers from other days might also be at risk. That's why we put all of them under compulsory testing notice. But so far, all the customers except one visited the restaurant between around 1 to 3 on 19th of February. So, and comparing with the possible index case who is a cleaner in the restaurant, actually there are quite a number of staff so far have been infected, but all of them, they have the either asymptomatic, or if they have onset of symptom, there's 20 something. So the earliest onset was onset of cough on 18th, and he developed fever in the afternoon of 19th. So we expect that period he is most infectious, and the CT value is 18 on testing. So it is possible he might be a super spreader. Of course, we can never confirm this fact. So and also we are studying the distribution of the tables, and they are all in the ground basement floor. So we are also tracing the other customers on the 19th to in order not to miss anyone who might be get infected. So for whether you go to a restaurant or not, I think you have to accept the fact that there's a risk whenever you take off the mask. So if you are going to a restaurant with your household contacts, then the risk is smaller because you are not meeting new people, and anyway, they are your close contacts. But of course, from this example, we can see that there are also other risks associating with meeting outside. So far, I think from this outbreak, I recall there's 1 or 2 who received the app notification and went to testing. And I recall there's one clearly said that, and the other one said she looked that there's a risk, maybe from the media or maybe from the web. We haven't clarified her yet.
About the effect of the Leave Home Safe mobile apps, I need to clarify one point is that this mobile app is an exposure notification app. It's never meant to be a contact tracing tools. We don't install any tracing components in the app. It's purely a digital tool to assist citizens to record their visit history of different venues, and also to provide exposure notification in case he or she has close contact or appear in the same venues with a confirmed cases. In terms of the effect, as Dr. Zhang just also mentioned, one of the clear effect is when you receive the notifications, you probably feel worried about that. I would advise you to go to conduct a test. And there is also cases that people receive the alert, do the test, and discover that he or she being confirmed cases. So this is one of the effects. And in terms of the download rate, actually we don't frequently check those download rates from elsewhere. But according to a previous few days ago, a media inquiry about the download rate of the mobile apps in Hong Kong's App Store and other app stores, we did a rather comprehensive checking of this mobile apps download rate from around the world. And then our finding is over 97% of the download is from Hong Kong App Store. The remaining 2 to 3% is from other app stores around the world. But I need to emphasize is that even the app store is from elsewhere, it doesn't mean that the people are downloading apps in foreign countries, because Hong Kong is an international city. We are aware that there's quite a lot of expatriate colleagues or students from elsewhere, studies in Hong Kong. Their mobile apps, their accounts are already attached to a foreign app store. And when they download the mobile app, the account will be counting to that foreign app store. So probably that is the reason why there is a few percent of the download is from other app stores.
下一條問多條英文問題，嗰邊嗰位間條衫嗰位。
Another English question.
The South China Morning Post. Dr. Chuang, we've seen reports that contact tracing measures are being tightened, including, so for close contacts of unlinked cases, so instead of those who've interacted with that case for 2 days, it'll be those who've interacted with that case for 7 days that will have to be quarantined. Do you have more information on that? And do you think we're seeing the impact of gatherings over the Lunar New Year now with so many cases floating out? And my last question is about the Leave Home Safe app. So what's the daily average number of users of that app? We know that it's been downloaded many times, but we'd like to know how many people are actually using it since it was made compulsory. And how long does someone have to be in the same place as a confirmed case to get an alert from the app of risk of exposure? Thank you.
We are observing, I mean, your news so quick concerning the contact tracing. We are observing a decreasing trend of number of cases in recent weeks, but the number has still maintained for maybe 10 or 20 every day. So with quite a number of significant proportion who are unlinked cases. So we are studying whether we can enhance our contact tracing efforts to further prevent the spread of the disease in the community and also among the close contacts. So we are studying a few measures to enhance the contact tracing efforts. The firstly is that for those unlinked local cases, so far we have not found a source. So their communicable period is usually 2 days before until he or she being isolated. But we know that he or she acquired the illness possibly from other close contacts earlier than his onset or her onset. So it is possible that he acquired the disease from another case who has not been identified during the incubation period. So it is possible that he may have a close contact 7 days or 10 days before his onset of symptom, and maybe some gathering or something. Currently, if we identify another case during the incubation period with, who had gathering with her, we'll quarantine that day or that period. But to find, so that one may be the source if he has an early onset. But we do not routinely do so. We usually will advise all these close contact during the incubation period to get tested. But for example, in one of the cases today, the staff who from this restaurant, he had contact with another case during the incubation period of that case. So at that time we advised testing, but we have not quarantined this staff. So subsequently, he has onset of symptom on, they met on 16th. That case had onset of symptom on 19th, and this case had onset of symptom at 18th. So to aid the contact tracing effort and also to find the possible source of infection for unlinked local cases, we would like to trace back a bit more. But if we trace back until 14 days, because it's already past the incubation period, so we can't quarantine this close contact. So we advise testing. But for those who are within 7 days of onset of symptoms, there's still 1 or 2 days, 3 or 4 days, that maybe 1 week up to 1 week, we can still quarantine them and get them tested. So in order not to miss out any source and any possible cases. For those close contact, this is for the unlinked case. So in order to try to see whether we can find more sources of infection during the incubation period. And we are also considering other measures, such as we're considering to issue compulsory testing notice for all the workplace. Currently, we are issuing compulsory testing notice for workplaces with 2 cases. But actually, for those small companies with 2 cases, we'll quarantine all the staff, essentially, because there's an outbreak. So we'll ask those workers with 1 cases to get tested. So we would like to see to issue the compulsory testing notice for all the workers with 1 cases. So in order to ensure the compliance. And the third one is that when we have a close contact who are symptomatic, for example, if there's a workplace, there's a colleague who is symptomatic, we will send them to hospital for testing. So there may be a delay of 1.5 day or so that he get tested and then confirmed to be a case or not. During that period, because he's already symptomatic, actually to us is a suspected case. So we would also want to quarantine their household contacts as well. But as the symptomatic close contact may get a negative result, so we will issue a 3-day quarantine order for this household contact until the symptomatic close contact get tested. If he's a positive case, we will extend the quarantine order. If he's a negative case, then he will be sent to the quarantine camp, and we will release the household contacts after they are also tested negative. Then the period usually is around 2 to 3 days. So we will issue a 3-day quarantine order. So we are studying these measures to see whether it is feasible to implement. If possible, we will implement these measures shortly to try to prevent the possible spread of infection in the community. And we are seeing slightly more cases, except for those related to the restaurant. We're also observing a number of unlinked cases. The numbers seem to be a bit more, for example, tomorrow. So many of them reported that they had quite some gatherings during the Chinese New Year and after the Chinese New Year, and also more activities than before. So we are seeing the effect of those gatherings. Yeah.
About the Leap Home Safe mobile app, actually the current setting is whenever you have at least 1 minute of overlapping with the confirmed cases visited venues, you will receive an alert. In terms of the usage rate, actually because of the privacy by design principle of the mobile apps, we never know and a user is using the app or not. We don't have these figures.
好，最後2條啊。
2 more questions. This one in purple. Good afternoon, Economic Times. First, I'd like to ask about Mr. Ming's Chinese dining. The staffer had an onset on the 18th. Did he go to work on the 16th, 17th? Would you trace the patients who visited on those 2 days? And about the collection of specimen bottles, is it due to the insufficient testing capacity that the test results were announced late? And about the company, can you tell us the name of the company and how many people have been quarantined? Would you dispatch experts to visit the restaurants to find out the source of infection. You mentioned that on the 19th, some 70 patrons visited the restaurant, but you only have a dozen sets of information of customers. Does it mean that the Center for Health Protection is unable to trace the remaining 60 patrons? Would you say that the Leave Home Safe app would give you a greater help in contact tracing? And can you tell us about the default of the contract? Which testing agency is involved? What is the penalty? And what is the supposed target of testing per day? And starting from next week, by how much will the testing capacity be raised?
For the person at Mr. Ming's Chinese dining, she worked on the 14th of February and then 18th and 19th. So we have to check the information. And she didn't work on the 16th and the 17th. And the earliest confirmed case was on the 18th of February, but she didn't work. So we said that the case on the 18th of February was a linked case, but we have to check again before coming to a conclusion. For the 3 staff members from the same company, they work in Maudi Road 66 Tsim Sha Tsui Center. Well, their colleagues have been sent to quarantine center. I don't have the exact figures here. I think the personal records and paper can help because we can call these people up, and we also have a hotline, and the Leave Home Safe apps has notified the relevant patrons, and they should know that there has been an outbreak there. Sorry, the speaker is not coming through. Well, we don't have the plan for the time being. Let me supplement. If you talk about using Leave Home Safe app, this is a simple and convenient tool, and we would cooperate with CHV to enhance the functions of the app. More different messages will be distributed to the relevant person through the app. Say if CHV finds that there is a restaurant or a venue entailing us to appeal to the relevant persons who have been there to conduct a test, and that can be done. Well, we will not infringe on people's personal privacy, and no record of the name and the telephone number will be made. It will work faster. You talk about Mr. Ming's Chinese dining? No. For most of them, well, after they have received our notification, some of them have symptoms, they went to the A&E department. So they didn't return the specimen bottle. And for some of them, we have sent them to the quarantine center, who were later confirmed. We are very concerned about the lagging behind of the test results. In accordance with the contractual terms, we are following up with the contractor. Commercial information is involved, so I'm afraid I cannot give you the details here. We are liaising with a number of private labs, hoping to solicit their assistance in enhancing our testing capacity next week. We're still following up on that. We hope to be able to identify a few more. The next question. The reporter in grey behind. I'm from Hong Kong 01. First, about a question about Mr. Ming's Chinese dining. There are a few patrons who are newly confirmed. You said previously there are 3 groups. What about the new confirmed cases? Are there more group outbreaks? And for the staffers confirmed, what position were they in? How many staff members were there in total in the restaurant? Are they all being quarantined? And for taking of personal details. 76 patrons have visited the place. So how many among them are still missing? Is some of the information on the paper records wrong, and that you weren't able to identify and locate them, the people? And Dr. Constance Chan, Director of Health, has, together with some of her colleagues, have taken the jabs. Dr. Chang, do you plan to take the BioNTech jab? Hence, you were not there this morning. Well, the total number of confirmed cases and preliminary positive cases will actually amount to 8 tables. So we're talking about 8 clusters or 8 groups. So that's about it. We are just still doing the counting. Well, at that lunchtime, there were around 76 people, but apart from those, some of the people have already been sent to quarantine. We still have to check who sat with whom and on which tables. We're still doing the counting. There are a lot more cases today. There are also some preliminary positive cases related to Mr. Ming's Chinese dining. I have not left my office, so I couldn't actually take the jobs together with my colleagues, but I'll do it as soon as I can. Well, the positions of the staff members, well, some are cleaning workers, some are waiters, some are chefs, some are the managers, supervisors, some are part-time workers, and so on and so forth. A dozen or so staff members were sent to quarantine centers. So these the newly confirmed cases of the staff members were actually confirmed at the quarantine centers. The reporter at the back. I'm from RTHK. First, a question for the HA. Have you received reports of patients confirmed only 3 days after submission of the specimen bottles? Will that lead to further transmission in the community? So how many cases are seeing the test results lagging behind? And how many private labs have you identified which can help you to do the testing next week? So how can you make sure that those who submit the specimen bottles can receive the test results ASAP within 3 days? Would you also increase the penalty for the private test labs? And would you be mandating them to submit the results within a certain period? And Dr. Chang said that cleaning worker at Mr. Ming's Chinese dining is a super spreader. Would the tables that she has cleaned become a source of transmission? And usually, cleaning workers will wear gloves during work. Has the worker worn gloves? Do you think this is a good practice? Is a hygienic way of cleaning the table? For the outsourced contractors, which will be enlisted next week. Actually, we are still going about in the recruitment exercise. I don't have the details. To my understanding, some members of the public have yet to receive the test reports after 1 week. And like I said, the demand has surged. Hence, the outsourced contractor cannot meet our requirements. We hope that the test results can be available within 48 hours. That was this patient, number 10904. The test results was not made available within 24 hours. And this patient has all along displayed symptoms. And this patient has been seeing the doctor all the time, and through the ANED, the patient was admitted into the hospital to receive treatment. I'd like to remind members of the public, if you have symptoms, please seek medical attention as soon as possible. We would provide you with the appropriate treatment.
懷疑
About our suspicion whether one of the staff members could be a super spreader, that's just a hypothesis at the moment. We look at the distribution of tables where the confirmed cases sat and the routes that staffers took. From the known cases, we understand that despite having 2 floors, most of these confirmed cases sat on the lower floor. This case had a fever and some coughs, so it's more likely that transmission took place via droplets. Perhaps the droplets suspended in the air for some time, hence infecting the patrons. Now about bussing tables, cleaning tables, contaminating them as a result. Well, because the cases concentrated on the lower floor, I think it's premature to give any conclusion. We have yet to complete our analysis. As for wearing gloves is more or less the same as bare hands, and if you just indiscriminately touch around, then you will have the same risk of infection. The speaker's not coming through. We've reminded the service provider to clear the queue as soon as possible. And as mentioned just now, we'd like to invite more private laboratories to participate in our work so that with increase in testing capacity, there will be spare capacity to help clear the queue. The last question, this reporter at the back. I'm from TVB. I'd like to ask for some information. You mentioned a male teaching in a school. Teaching in a school, is that right? And also a 16-year-old male student, also a kindergarten teacher, lady teacher, also a 38-year-old male living in Changfat building. May I know where they work? Can I have the work address, please? I think the question was put in English about the Leave Home Safe app. How many close contacts have been identified via the app? Could you also repeat the answer in Cantonese? And Dr. Ho, you just now mentioned testing capacity and the specimen packs.